Our top story at 5, the surge in coronavirus cases across our state continues. Local hospitals feeling the strain. Right now, there are roughly 150 COVID patients in the UC Health system. That's triple the number they cared for during the previous peak in March and April. Some 318 people currently in the hospital with the virus in El Paso County. News 5's Andy Cohen live tonight from UC Health Memorial with a closer look at the way that the hospital leaders are handling this surge, Andy, and what state leaders are projecting will come in the weeks ahead.
Yeah, Rob, we can tell you, Thanksgiving was a week ago, and because of the time that's associated between exposure to onset of symptoms and then someone going and getting a test for COVID-19, the state health department doesn't think we're going to see the full impact of any holiday gatherings from Thanksgiving for at least a couple more days until next week, and they are already urging caution and warning folks about getting together for the holidays later this month.
Colorado's epidemiologist warned against getting together for Hanukkah, Christmas, and Kwanzaa this year.
To cancel gatherings with people who do not live with you. That includes upcoming holiday planning, wearing a mask when you must go out, and staying at least 6 feet away from others at all times.
She says the spread of COVID-19 is very high right now. We won't know the full impact from Thanksgiving until early next week, and the current modeling suggests that infections, hospitalizations, and deaths will all rise.
We get, I think, a pretty good picture of what will likely happen in the next few weeks with a continued rise of the curve.
The stress on Colorado Springs hospitals is already evident.
It's almost like a mass casualty event in slow motion.
The medical director at UC Health told reporters that they're caring for triple the number of patients they did during the previous peak in April and May. Elective procedures are on hold so that more doctors and nurses can help with the surge. The governor has asked hospitals for a plan to double the number of COVID patients, which he said could mean lowering the quality of care.
Every time we move forward with a larger number of patients, we have to attract things that we can do. We have to sort of figure out ways that we can cut corners on normal charting and things that we do all the time that are part of regulation and part of overall safety, and figure out ways that we can push the limits.
And the governor could always activate the National Guard and set up a temporary alternative care site in the community to try and relieve some of the burden on hospitals. But the problem with that, Dr. Steinbrenner points out that here in Colorado Springs especially, a lot of the doctors that would be staffing that with the National Guard actually work in our hospitals, so you're just kind of moving people from one place to another. Always watching out for you, Colorado Springs. Andy Cohen, News 5.